And now I'm going to, with great pleasure, introduce my colleague, Dr. Ehtesham Khalid. Dr. Khalid is the neuromuscular section chair in the Pakistan Society of Neurology. He is the consultant neurophysician at Ideal Medicare in Multan, Pakistan, and he identified the cause of a patient's neuropathy that he will tell you about now.
Thank you very much, Julie, and it's an honor to be on this platform, and I really appreciate the organizing committee of this symposium for this invited invitation for my presentation, and thank you, Julie. So it was a very interesting case, and because I learned a lot from this case, so I call it knowing the unknown. As you can see from my first slide, I am a neurologist and a neuromuscular subspecialist by my background. I was part of the undiagnosed disease network while I was working in Vanderbilt. And that was the time when I developed more interest in rare disorders, especially genetic neurological disorders. I have no financial disclosures to make regarding my presentation. Starting with my case, who was a 17-year-old female who presented with numbness and burning sensation in her right hand and foot for the past 3 months. It started with the left hand 4 years ago, and it improved over the next 2 years with some medication, mainly it was steroids. There was a decreased strength in the turning and discoloration of her left hand during that time. She also had numbness and weakness of the left foot up to her ankle, due to which she needed some assistance in mobility. She had a similar episode in August of 2020, which again got better with some supplementation and medication. In terms of her developmental milestones, she developed normally. She was getting good grades in school, so there was no issues with respect to that. But her family history was significant. She had 2 sisters who suffered from some serious illness early in the age and died. And the older one developed hyperpigmentation, her milestones were delayed, and she died after developing high-grade fever. The younger one had kidney. She was on prednisone, and she was hospitalized for meningitis. During the hospital stay, she developed a documented proteinuria, and she died later at the age of 2 years. This was her initial motor examination in my clinic. And as you can see through the slide on the left-hand side, which is the upper extremity examination, on the right-hand side is the lower extremity examination. And she was less weaker in the shoulder and more weak distally in her hand. In the lower extremity, she was symmetrically weak in her right leg. But on the left side, there was no weakness. Her sensory exam showed some vibratory sensory loss in her toes, and there was decreased pinprick sensation up to mid-feet. As this patient was having evidence of sensory motor neuropathy, so to understand the case better, she was referred for nerve conduction study. So this study was done before what we started her on. So in the initial study, which if you look at the left-hand side, especially the upper part is the sensory study, from mid below is the motor study. So in the right median sensory examination, there was no response on nerve conduction study. In the right ulnar, there was a response. On the motor study examination, in the right median nerve, you can see the amplitude was reduced and the latency was not very much prolonged. In the right ulnar nerve, again, the latency was okay, but the amplitude was reduced, which goes more with the axonal variant of polyneuropathy. So it was reported as moderate asymmetric sensory-motor axonal polyneuropathy with degeneration changes. Thinking of that, she's autoimmune. So anti-CCP, rheumatoid arthritis specter, ANCA, ANA, ENA profile was done, including CCP, and all of those were normal. Her basic inflammatory markers, talking about ESR, C-reactive protein, were normal as well. Her TSH was normal. Thinking of her kidney involvement, The Best-Jones proteins was done and it was normal as well. Same goes for serum immunofixation levels. Because her symptoms were unilateral on the right side, so MRI brain was done as well, and it was normal. As this case had some significant family history, so she was subjected to next generation sequencing, and it came back positive for homozygous mutation for SGPL1. This mutation, as Dr. Sabha elaborated in her presentation, is mainly seen with autosomal recessive nephrotic syndrome. Case shows what happens with the clinicians in the clinic. Next generation sequencing, many a times we do see a variant of unknown significance. So it becomes really hard to understand the genetic results. And that's the time you consult your genetics team. And I had the opportunity to talk to one of my colleagues who is Mayo Clinic trained, and Dr. Salman Kermani and his team. And that was the time they got me linked with Dr. Sabha. And it was very, very helpful link. And as Dr. Erb nicely mentioned in her presentation, that was the bridge that we developed to help our patient. Then we increased her dose in January. And at that time, she had a repeat nerve conduction study and clinical assessment to see what's going on. So if you see, compared to the previous slide, so I put down the initial exam, which is pre, and the follow-up exam, which is post. And again, if you see in this case, she improved in her pre compared to the post exam. So initially her strength was 4, and now it was 5, which is normal. Distally in her hand, she was initially 2, but now it was 4+, which again shows that she has improvement in her motor strength. In the lower extremity, her strength also improved to normal. To confirm our findings on the clinical exam, she had a repeat nerve conduction study, and the same way, I put down the pre and post treatment nerve conduction study numbers for the ease of the audience. So the right median sensory study, which was initially no response, there was a response, and it was a good amplitude in the sensory study. In the ulnar study, the latency remained the same or changed a little bit, but amplitude improved. On the motor study, if you look at that, in the right median latency, it did prolong a little bit, but the amplitude, almost 50%, it improved. And same goes for the ulnar study, and there was some improvement in the amplitude. Again, for the audience, as a neuromuscular subspecialist, when we are documenting improvement or recovery, what we are more interested in is the motor exam and the motor part of the nerve conduction study. And this nerve conduction study on follow-up confirms our improvement, which was also seen clinically in our patient. These are the graphs which Dr. Julie also shared in her presentation. So these are shown in a much bigger format for the audience. So in the pre-treatment, you can see the amplitude was small. In the post-treatment with vitamin B6, the amplitude improvement quite a bit. And at the end, this is a brief interview of my patient who shared her feelings and answered a few questions for the audience. And at the end of my presentation, I would like to thank you to the organizing committee, and especially Dr. Julie, who has been a great sport during the care of my patient. And I really believe it really helps developing bridges in providing quality care internationally. And I have Aksa Sultan with me, and we're going to have some questions for the audience, and she will share her experience through the disease process that she is going through. So Aksa, just let us know that what brought you to the doctor for the first place.
I felt numbness in my right hand and right foot, so I was worried what's going on, so it brought me to the doctor at first place.
And how does a day look like in your routine life? So what you do in a routine day?
I play with my nephew, I use my mobile, watch TV, and like this.
Do you study?
Yes.
Okay. How this disease is affecting your life?
It affects my mental health so much. It makes me disabled, and that affects very much in my life. So
So are you able to do your routine chores at home? Are you able to study? Or is affecting in any way?
I am trying to do, but I'm not doing that very well like I was before. I was used to do.
So, and how have your symptoms or ability to function changed over time? So, since you have been diagnosed or even before the diagnosis, what changes has been there, like in the start, before the diagnosis and after the diagnosis?
In the start, it was like my hand was not working anymore, and I felt like I am disabled. But after diagnosis, after the treatment, I feel like my hand is now start working somewhat, and I am able to walk. Before I was not able to walk.
Nice. And what about the numbness you were feeling? Is it still there?
It's it, but not like the before. It is better now.
Okay. Nice. So, how difficult was it to obtain a diagnosis for your condition?
It was difficult because in the past years I was able to move, to do whatever I want, but now there's a big change in my life. But it's not impossible. I can do that.
But how did you get to the diagnosis?
Before, since 4 years, we were visiting to the doctors, different doctors, and they were like, "It's such you are doing a trauma, and there's nothing like that in our career. We did not see that." But after 4 years, we met a doctor, Dr. Ehtesham, and he used to say that I think she has a genetic problem. So after that, we diagnosis with it, and now I am satisfied with the treatment.
Good to know that. So, and how's the treatment changed your life?
Treatment changed my life, like it makes me positive, and I am now able to work and move my hands, so it has very changed my life.
Nice. And what treatment you have been given over the period of time?
Firstly, I used steroids that are very heavy for me, but afterward, now I am using Vita 6 and Dulan and New Cap, and it makes me feel good.
And also, let me know what would you like to tell the world about living with a very rare condition? Because you know you have a rare condition; it's not very common. So, what would you like to tell the world about it?
It makes you a special person, because the person who is sitting in front of you is not feeling the same what are you feeling. So firstly it was not good, but it is also like you are a special, and I hope the persons who is behind the camera are not have to not feel what I am feeling.
What do you wish for?
I wish the persons who is facing the same real problems have been cured, and it has treatment for the people.
Thank you very much, Aksa. And I know, and I wish you and all the people who are suffering from similar condition uh, can get a proper treatment and they can improve. I really appreciate for your time today. Thank you very
Thank you.
much.